Urinary incontinence treatment is the subject of this video. Hi, I'm Dr. Shakib from Core Pelvic Floor Therapy in Irvine, so stay tuned. Alright, so you have urinary incontinence and you're wondering what the proper treatment for it is. Other than medication, which you might have done, which, as you know, doesn't work long term. Other than using products which really don't fix any problems, any of this problem, but they kind of allow you to move on with your life and go on with your life. The real treatment of urinary incontinence has to do with the cause of your incontinence. I've done a video on what causes urinary incontinence, so we're going to make sure we put it at the end of this video so you can watch that. So assuming it's not nerve related, assuming it's not the enlargement of your internal organs putting pressure on it, or weight that's imposing pressure on the pelvic floor, assuming those are not the case, then your urinary incontinence is more than likely caused as a result of dysfunction in your pelvic floor. So to address that, we need to look at the alignment of what it takes to hold your urine. So if your pelvis is consisted of bones and joints, and then there are body parts like your hips and your lower back attached to it, then the positioning of your pelvis, if it's tilted forward or backward, if it's side to side, all of those impact the integrity of your pelvic floor muscle. So if you have this urinary incontinence and you're seeing a pelvic floor physical therapist who goes through the anus and or vagina to address the inside of your pelvis, for one, you're at the integrity of how long the finger is to begin with. But there is importance in what is performed, but that's not comprehensive. What is fully being ignored is what we do to strengthen the pelvic floor muscles, which is Kegel, but you're not doing enough Kegel exercises. To jumpstart you, we need to give a lot of Kegel exercise, which emsella chair does. It's designed for incontinence and it provides over 1 Kegel a second. That's it's exactly 400 Kegels a minute. It's over 1 a second. And over a course of 28 minutes, it's 11,200 Kegels. So you strengthen that, but along with that, you need to incorporate your breathing, how your pelvic diaphragm, your abdominal diaphragm work together. It's a huge thing, which, by the way, some of the pelvic floor physical therapists actually do with their patient as they're inside, and they can kind of coach the patient to do it. In our practice, we don't do that. We have devices that with computer attached that we can see how well you're doing your breathing. So that is your continuous, when it's done right, it's a continuous reinforcement of the integrity of the pelvic diaphragm, which is huge with the health of your pelvic floor dysfunction, and in this case, urinary incontinence. Then we have to work on what it takes to have functional movement of your body parts so you're not feeding the lack or the weakness that you have. In order to understand this, I invite you to check out the link in the description box we're going to put for what is referred to as developmental kinesiology. That's the movement that babies do, or the movement patterns that babies do from all over the planet, regardless of our differences. We all have done it, you and I both. So that's really addressing all different feeders of your urinary incontinence instead of blaming something else that led to this thing. We're not addressing these issues properly. So look into it further. If you have any questions, make sure you contact me, and check out my website, my YouTube channel with the different videos on the very subject. Thanks for watching.